Welcome to Q&A, a program that raises questions and provides answers to issues important to the community. Today's discussion surrounds Massachusetts elder care in 2011. What we have, what we don't. Our host is Sally Hoyt, Senate President of the Massachusetts Silver Legislature and a member of the Reading Council on Aging. Sally also served 12 years on the Reading Board of Selectmen. And now, the discussion.
Welcome. Today we have two distinguished guests, and I will introduce them to you. Dan O'Leary, Mystic Valley Elder Services, and Al Norman, Executive Director of Massachusetts Home Care. We're going to speak today about home care and services at home as well as in the community. Now, Dan, I'd like to ask you a question first. Now, what are the services available at Mystic Valley Elder Services?
I'd be happy to talk about that, Sally, and thanks for having us today on the program. First of all, before I get down into the specific services, Mystic Valley Elder Services is one of 27 agencies that serve every city and town in the Commonwealth of Massachusetts. So whether you're watching this in Reading or maybe one of the other local communities, you can reach Mystic Valley Elder Services or our statewide information line at 1-800-AGEINFO, AGEINFO, and Al will talk about that, our Executive Director of the Statewide Association. So when I'm talking about Mystic Valley Elder Services, the services we provide, this is the nice part about it is we have a whole statewide organization that provides, through the organization, services, whether you're here or in Berkshire County. So basically, our agency's mission is to help older people and adults with disabilities remain living in a setting of their choice. And what goes along with that is everything you can well imagine, whether it's helping find housing for people, helping people get from their home to the doctor, transportation, personal care services in the home where people need a little bit of help getting up in the morning, getting dressed, bathing, etc. We're also the agency that provides the Meals on Wheels program. We have health insurance counselors where people can call us to get information and advice, whether it's on the Medicare Part D or other health insurance issues. So we have a range of services that really is rooted in a personal approach where a person can contact us by the telephone, through the web, and certainly we're more than happy to come out and meet with a family and an older person right in their own home to talk about what options are there for that person to be able to remain in a setting of their choice. And 99% of the time, that setting is their home. So in general, what we are is the contact point in this area in agencies across the state to help people connect with the services they need.
Wonderful. And now, Al, with respect to elder services in Massachusetts, what are the services we do have, and what are the services we have yet to have?
Well, as Dan just said, there's a lot of in-home support. We want to make the message clear to people that if you're thinking about a nursing home, before you make that decision, call 1-800-AGE-INFO and talk to people about what are my options. In fact, Mystic Valley Elder Services has a program specifically designed to counsel people who might be considering an institution. People should know that in Massachusetts over the last 10 years, we've really been dropping the number of people in nursing homes. It's declined by almost 30%. And that's because of agencies like Mystic Valley Elder Services and our other members. And so we tell people, check out what your options are. The program specifically is called Options. Find out what other services can be put together to keep you living at home, because that's where most people want to be. So that's a big one, is to remember that there are these alternatives. But there's a lot of services we don't have that we can talk about in the show if you want.
And that's very good information. And now, Dan, your agency works to try to keep people at home, including some very disabled people. But what are the options for people who have significant needs, but they want to live in the community?
Great question, Sally. We provide a range of services for people who need just a little bit of help for a short period of time, and as you said, for some folks who really have a lot of extraordinary help, generally around personal care needs and other needs to remain in the community. One of the good things about living in Massachusetts, and there are a lot of good things about living here, one of them is that the state has made a commitment to providing true alternatives for people who otherwise would have been in an institution. As Al just said a minute ago, about 30%, I think you said, Al, nursing home bed reduction in the last 7, 8 years.
Right.
In large measure, that's because that more options available in the community. Give you an example, a person who's eligible for Mass Health, in Massachusetts we call Medicaid Mass Health, it's just another name for Medicaid. Sure. If you are eligible for the Mass Health program, you're eligible based on what we call clinical needs, in other words, a need for nursing home care, and you meet those guidelines, you can be part of what they call a Community Choices Program, which is a program that Mystic Valley Elder Services administers, as well as our sister agencies across the state. And you can get basically what you need to remain at home. We have, to give you an example, we have clients who are getting 24-hour-a-day care. Not many. It's very expensive. It's in excess of $50,000. But there are people who need that level of care, who get that level of care, who get that level of coordination. So when people think about home care maybe as only an hour of cleaning, those days have changed happily. We've argued, the legislature heard us, the governor has heard us, when I say us, I'm talking about the public, not just Dan and Al and Sally, but the public has said, we want a true alternative to nursing home care. And that is now available in the community. So we have folks who are at home. Literally 5 years ago, it would have been inconceivable, based on their level of need, their disability, that they would have been able to get the kind of personal assistance to remain in the community. And they are successfully living here in Reading at home. So I guess the most important point I would say to folks, to the viewers, is don't rule yourself out. Make the phone call, connect with us through 1-800-AGE-INFO, or connect directly to Mystic Valley at 781-324-7705. Anyway, just make the phone call. I see our job, Mystic Valley's job, number one, is to help the person formulate and ask the right questions and then get the right answers. Because people, I think one of the biggest problems is they assume things are not available and they don't make that call. So make the phone call is what I say.
Thank you very much, Dan. And Al, I've lost my voice, so you'll have to bear with me. I understand that in some programs, elders can choose a son or a daughter to care for them. But what are we doing to have a spouse be a caregiver and be paid for his services?
Well, we're not there yet. We're pushing for the right of people to hire their spouse to take care of them. And the reason we're doing this is that we're going to have, over the course of the next 20 years, we're going to add about 700,000 elderly people to the population. It's the fastest growing part of our population in this state. We just simply won't have enough caregivers to provide care for all the people who are going to need it. Couldn't hire that many people, couldn't find that many people in the family. We're going to need to tap into every single resource we can. In Massachusetts now, there are certain programs that are offered by Medicaid that allow you to hire a son or a daughter, for example. The adult foster care program is one. The personal care attendant program is another. These are great programs because it's family taking care of family, with the notable exception that if you're a spouse, they won't let you be paid for doing that. Now that's simply stepping right over someone who could provide great care because they love the person, they want to provide that care, they're in the home already. And for the taxpayer's point of view, what we're trying to do is prevent that person from going into a nursing home. So why not take advantage of the fact that every day and every night there's a person in the home? I mean, again, these are some of the foolish policy decisions we make because we get hung up on what's the relationship. I don't care what the relationship is. Keep the person out of the institution. So we filed legislation, Sally, to allow spouses to be caregivers. We're hoping this year it'll pass. And I'd urge anybody who's viewing this show to call their state representative or state senator and tell them that you want to see spouses have the right to be paid to keep another spouse out of an institution.
Well, that's very good information. And as soon as that bill has a bill number, I think we'll share it with the public. And I, for one, will be sure that it gets all the support it needs.
Well, thanks.
So please be sure to let us know as soon as a
People can call now and just say to They're lawmakers. Spouses should be paid as caregivers. The lawmakers can figure out which bill it is that we're talking about.
Sure, well, my experience has been that family members do much better caring for their loved ones at home. And it's not that they don't appreciate having people come in, it's just that they seem to get the care that they need, and they have the confidence that they need just by having a loved one care for them. I think it's a normal thing,
right,
to have that spouse be the caregiver. So I certainly hope that we can make that bill the law this year.
One of the things I just want to add to what Al's talking about in terms of consumer direction is that in addition to the programs that Al just mentioned, within our home care programs, when we go out and sit down with the older person and his or her caregivers, or if they're available and involved, is we'll talk about what makes the right mix of services. In other words, you could use a consumer-directed model. We have through the ability where if there was a portion of the care plan was going to be provided by a neighbor, family, or son or daughter, and then you supplement that with services brought into the home. So it's a matter of figuring out on an individual family elder basis what makes the most sense. And we have staff, Al talked about an options counseling program. We have care managers, and we also have nurses who come out. They're not doing hands-on care like the visiting nurse. We work with the Visiting Nurse Association or the Home Health Agency. Our nurses are working with the care manager, with the family, with the elder to figure out in total what is the right mix of services. How do we effectively help that person, that consumer, relate effectively to their physician and their health care provider? Because a lot, as people know and what we hear, we've heard time and time again, is that you're in the hospital, the healthcare system is working well there, but there's not a smooth transition from the hospital to the rehab facility or the hospital to the home. And so this options counseling program is, we now have the ability to be able to send one of our staff to the hospital to meet with the person, the patient, the consumer, the hospital discharge planner, the physician, if he or she is available and wants to be involved with that, so that we can make sure that the services that are required to get you home, literally to get you home,
of course,
are in place. I mean, Sally, you and I have talked about this. Sometimes one of the most complicated aspects of going from the hospital to home is literally who gets you home, who drives you home.
Sure.
You're handed a stack of prescriptions. Who's figuring out how do you get to the pharmacy to get the prescriptions? Who buys the quart of milk on the loaf of bread? Sounds, sort of basic, but that's a lot of times what is preventing somebody from getting home and then getting the services they need. So we're all working together to try to make those transitions seamless. And that's a challenge, it's an opportunity, and we're making progress.
Sure, and that information does make sense. It
makes sense, doesn't it?
It does make sense.
Right, but common sense doesn't always, it's not always common, is it?
No, not always.
Well, so we have to work at it.
Sure. Well, Dan, I have another question for you, because I do understand that you have workers working in nursing homes who are trying to counsel patients so that they can return to their home. And so how does that program work?
Yes, that's a great transition from what we just talked about. Is, as I was talking about, we have staff who are available in going to the hospital. We also have staff who, on a weekly basis in our area, go to each and every nursing home. Those, in our case, they actually happen to be nurses. So they're there to do a couple of things. First of all, they're there to make sure that anybody who would like to leave the nursing home and transition back to the community, that we are there to work with that person, the nursing home staff, to make that transition. They're also there to make sure that folks who are on Mass Health and Medicaid, in fact, need to be in the nursing home, because Mass Health, again, they're on, I'm going to say, they're on our side. They're on the consumer side. They want to make sure that only the people who need to be in a nursing home should be in a nursing home.
Sure.
We don't want to be paying for people to be in a nursing home if they don't need to be there. So our nurses are at the nursing home making sure that people's eligibility, that they need to be there. And two, for those people who actually, quote, meet the eligibility guidelines in terms of being appropriate for nursing home care, if they're saying, I know I can stay here, but I don't want to stay here.
Yes.
How can you help me go home? We're there to do that as well. So it's really, again, same concept, going to where the consumer is, hospital, nursing home, community, sitting down with them saying, let's talk about the possibilities, what are your needs, what would you like to see happen in your life, and let's see if we can make that happen.
Sure. Well, I've personally heard from people in nursing homes who often tell me, when am I going home?
Right.
And that's the thing that they're looking for, and they do want to get home. If that is at all possible, I'm sure that they will eventually get home.
Right. And Al probably, I think he's going to talk about this, but there's a challenge, and I'll just say in our society and in our service system, is that everybody, all of us want to live a good quality of life.
Of course.
And we often will equate good quality of life with being safe. And that's always a challenge for us, because nobody's going to say, well, we want to make people unsafe, but sometimes that rubs up against that us as old adults that can make our own decisions. Sometimes we'll say, I will accept a certain amount of risk in terms of trading off some, quote, safety. And sometimes we get into debates about where family members, healthcare professionals, people in the community, social world say, she can't really go home because she's not going to be safe. But the person will say, no, Dan, I'm old enough to make my own decisions. I hear what you're saying, but I would like to go home. I understand the risks. Help me out. And our job is to help you out to make that happen.
Wonderful. And Al, what about the idea of a small group home for people who have extreme problems and they need constant supervision 24/7? How do we care for them?
Well, this is a follow-up on what Dan was just talking about. We happen to be a state that doesn't have a program that allows 3 or 4 elders to live together in a home. It cuts down the cost to the state and allows them to be supervised by 24/7 staff. We've been trying to develop a program like that for several years, and the Commonwealth has been doing nothing to make it happen. Other states have taken this and run with it, and they've used it extensively, again, as an alternative, because as Dan said, there are some people who require supervision day and night, and sometimes one-on-one placement doesn't work. Leaving them alone in an apartment doesn't work. But if you can put 3 or 4 people together in a home, we had a project called Back to the Ranch that did that, and we actually have 4 homes up and running now that we think could be expanded all across the state. But this is an example of a good idea that isn't being implemented, that would give people the true choice of being able to live at home, even though some others might say they need to be in a nursing home. We're saying you could be home, and in this case, a small environment. So again, we have filed legislation that would allow what they call residential habilitation to be part of the Medicaid program, so that we wouldn't have to be just dreaming about this program and only have 4 sites. We would be able to have it statewide. So that's on Beacon Hill now too.
Well, that's interesting too. And I think we certainly will support that bill as soon as we have a bill number.
Good.
And Dan, can you tell us about the Adult Family Care Program, and how does that program work?
Yeah, that's Al mentioned that at the outset. What they called it adult foster care, adult family care. I think we're calling it these days AFC. A couple of things is, number one, you have to be enrolled in Mass Health. You have to have essentially a level of need that would be eligible for nursing home care. So it's not for everybody, but it's for certainly a great option for folks who are in the community and are willing to need a level of care that is provided by a family. Now, when this program, just a quick note, when this program first started out, it was the idea where the older person would go, probably did not have family, but did not have caregivers, and they were going to go to live with another family. Through trial and error, if you will, and what people needed, is it has evolved where you can do that still, but you can also stay in your own home and have your family member, again, with the exclusion of your spouse, be paid to provide that level of care. So what's happening, more and more people are opting to stay with their own family and be part of the adult family care program. But this is a great option because it allows somebody to stay home. People, by definition in this program, are quite disabled, and the caregiver can be paid a stipend to provide that level of care. So it's another excellent option for somebody who needs a significant amount of care, but can remain at home with a loved one.
Sure.
And the pay, by the way, the stipend that Dan mentioned can be, once you count what the consumer themselves is paying as well, can be around $24,000, $25,000. So while it's not, really what you would call a full-time equivalent job, sure, it's enough for many people to make it attractive as a form of income, so that a son or daughter, for example, could step out of the workforce and take care of their parents. So
sure,
it's a program we have to expand.
Yeah, and if I can just
sure,
put a plug in here, if you will.
Sure.
We're touching on a lot of acronyms: AFC, GFSC, Choices Program, blah blah blah. And for the viewers who might be sitting here saying, "Oh my goodness, how am I going to remember all of this? How do I know which program to ask for?" Again, I would tell the viewers, that's in effect our job. What the viewers should do is, if we're touching on an area in their life that they have questions about, to call our agencies. As a director of Mystic Valley Elder Services, I tell our staff, our job is to help the consumer figure out the questions and then get the range of options and answers so that they can select from what makes most sense for them. So people don't have to know the answers before they call us. They don't have to know and say, I know about ABC program, that's the one I want. That's fine if they do, but they shouldn't feel put off because of the alphabet soup that we often people use in bureaucracy about this program and that program. Just make the phone call, make the connection. We'll figure out with you what the best options are. And then ultimately, it's the consumer's choice of what makes sense.
Sure. Well, it does make sense. And now, I know in the past you've mentioned that Massachusetts is not spending enough for community care. Now, what is the percentage for the funding for home care as opposed to nursing home care? And has the the care in institutions receiving more in funding now than the community care?
Well, Sally, you remember, because you were part of this effort, you remember back in 2006 we got a law passed called the Equal Choice Bill, and that law said that people have a right to be cared for in the least restrictive setting appropriate to their needs. Well, so about 4 years later, here's where we are. Our state is spending about $2.1 billion on long-term care for people over the age of 65 under Medicaid. $2.1 billion. Of that total, $1.4 billion is spent on nursing homes, and around $700 million is spent on care in home. So basically it's 2 to 1. 66% of our money is still going to nursing homes, even though we've dropped the number of days that are being spent in nursing homes. Mm-hmm. The cost keeps going up. The cost per day keeps going up. But we have managed to at least expand some of our home and community-based programs. And we're now down to, we're at 34%, and we want to at least get to 50% of the money, because we know that what the elders want is to reverse that number. They would like to see 66% of the dollars going into community care. And if we made a change like that, then we'd be able to continue to see more and more people being able to stay where they want to be. So this is a matter of honoring their preference. Sure. It's not something we made up. They've told elected officials we want to stay home. And as of 2011, we are still at the point of 66% of our Medicaid dollars for long-term care going into institutions. We're going to change that, but it's been very slow to happen.
Al used to say, and I know you have too, Sally, is that home care ought to be the care of first resort, not
Absolutely.
Last resort.
It is. And it is people's choice, and it's their right to be able to stay at home or in a community setting rather than be in a nursing home. I have heard of only one person who wanted to go in a nursing home. I am absolutely, naturally, I feel that this is what I would like to do, and my family members would like for me, is to remain at home as well as my husband.
Well, we need to talk to that one person.
Well,
maybe we could change their mind.
I think that one person was being contrary. I really do. But that person has a choice.
Right.
We all have a choice.
Right.
And if you want to stay in a nursing home, that's okay, because there'll always be a need for nursing homes for those who cannot care for themselves and cannot receive the level of services that they need. So I am not downing nursing homes, because I think there'll always be a need. However, for those of us who wish to remain at home or in a community setting, we have that choice. We cannot be forced to go into a nursing home. And certainly, it is a law that we do have this choice.
Well said.
Now, I do have a question. Well, I do want to be sure the public shares with us a tax issue, and that is the circuit breaker tax.
Yeah, it's tax time, so we want to just mention that if anyone, and this applies to renters and homeowners, not just homeowners, but people over the age of 65 in this state have a right to a credit, a fully fundable credit. Even if they pay no state income tax, they can get up to $970 off their property tax bill. And we found that a lot of seniors don't know about this. So again, what we say with this kind of thing, call 1-800-AGE-INFO. You'll automatically be connected with the local agency in your area that knows this information. And when they pick up the phone, say, I'm looking for information about the circuit breaker tax credit, please connect me with someone who can tell me about that. Sure. It's a lot of money we're talking about, because as you know, Sally, it's retroactive also. It can go back 2 years. So we're talking about, this could be close to $3,000 that somebody could save. And for people who are struggling to make ends meet, this is a big credit that they should take care of. And a lot of people, a lot of seniors still don't know it's out there.
Right, and as Al said, it's not just for property owners, it's for people who rent. With the only exception of people who live in public housing, subsidized housing, they're not credit. But anybody who's in the private marketplace, in terms of paying rent or owning their own home, yeah, they absolutely should take advantage. This is a wonderful benefit that the Massachusetts government legislature has provided to people in order to help them remain in the community. So they should definitely take advantage of it.
There are some income levels, and there are some levels in terms of property value, but they're very generous.
Yes, they
so
are.
No one should be sitting home thinking, oh, well, that's just for very poor people. This is a program that you should find out about and learn about, because you may in fact be eligible for a good payout.
And this is across the state. Again, it's not just here in Reading or Northeast Massachusetts. It's all over the state.
Right. And I've noticed each year the exemptions are higher, so that you can
every year.
qualify. If you didn't qualify before, you may qualify now.
That's right.
And I think everyone should take advantage of it, do the figures, and see if you do qualify. You'd be amazed. And I certainly have been amazed at people who said to me, well, I don't think I qualify, and I've told them, I said, do the figures. And the form is right in your Massachusetts package, your tax forms that come to you by mail to your door.
Yep.
And if you look into it, look for CB, Form CB, circuit breaker.
Right.
And they also have the instructions in the back, so that you know exactly whether or not you're going to qualify.
And even if you don't normally file taxes, you can file the form.
Yes.
And if you don't have access, if you didn't get the forms in the mail, call 1-800-AGE-INFO, and Mystic Valley and our organizations have those forms available to send right out to you.
Do you want to mention how people can contact you so that they can get additional information on the subjects we spoke about today?
1-800-AGE-INFO, AGEINFO, is the best way to get to either of us or the information that you need. Dan, you can give them the Mystic Valley number.
781-324-7705, or again, toll free, 1-800-AGE-INFO.
Thank you very much, gentlemen.
Thank you.
Welcome. Thank you.